It'll be like 10 minutes. I just want you to tell me and answer some questions.
Okay.
Okay? So, healthcare crisis. You told me you had lots to say about that.
Okay. Do you want to ask direct questions
Yeah,
or?
I'll ask some direct questions and you can just tell me anything you'd like to say.
Alright.
So, why do you think there's such a spike in the need for nurses and doctors?
Well, I think it increased population, both from natural growth, immigration, plus there's what you call a demographic blip. I'm a baby boomer. These are the people that were born in the 50s and early 60s.
Yeah.
And most of us are the children of World War II veterans came home and get married. And there's a lot of us. They had to build extra schools when we were kids. Now that we're getting older, we require more health care.
Yeah.
So there's demand there. The other reason, a lot of the healthcare workers are of that demographic. But my wife was a nurse. She
Yeah.
graduated in 1983. She retired a few months ago. And a lot of her friends, well, same with the doctors and other healthcare workers. The other thing is, like a lot of family doctors years ago were willing to work extended long hours.
Yeah.
I mean, I don't think they had a good life, but they
Yeah.
did it, and they really shouldn't have had to. The younger doctors today are want a better work-life balance, so they don't work that many hours. So there's more demand and less availability of people to supply it.
Yes.
And also, there's more service available. People asking and wanting that. Like years ago, if you had a cataract, you spent the rest of your life blind, or if you had a
Yeah.
hip problem, you were in
Yep.
pain and strutted around for. Now they have medical procedures that can correct that, so
Yeah.
there's demand that way.
So, another question would be, how is it going to change? What do you think it has to happen to make it better?
I don't know if we can make it better. I don't think we have enough taxation resources to supply the medical aid that people expect or want. So I think that it could be rationed. It's being rationed now. You only get so much over a certain period of time. I'd like to be more hopeful that maybe there are funds there that we provide more services for people, more training, more healthcare workers, nurses, doctors, respiratory therapists. My own son-in-law graduated this spring as a doctor, and he had to wait 5 years. Made 5 applications to go to medical school. He would have been done long ago if he had taken them the first time. And there's more people want in than there are available spaces.
Yes.
If we expand the available spaces and for not only doctors but every allied health profession, like physios, nurses, lab techs, then we have to understand that that's going to take a lot of money. So we might not be able to have the resources for other things in our society. And then now we got problem with Russia and China and the United States not demanding we pay more in the military. Like our defense requirements are going to go up, our medical healthcare requirements are going to go up. So how is that going to affect us as a society? Well, there'll probably be other services that will have to dwindle.
Okay. So, you said with the population increase, immigration contributes to that. So, do you think if we numbered the amount of immigrants coming into a country, we could have a more stable healthcare system?
We needed immigration. Cultural mix is good. We didn't have enough replacement workers for the baby boomers that are dying and retiring, and the younger generation weren't really receptive to doing work that a lot of immigrant people are willing to do.
Yes.
So immigration was good, but I think that was only part of it, because by and large, most of the immigrant people coming in are young and healthy. I think it's that large baby boomer generation that are getting older and needing more medical care. People live longer or exist longer, so they need rather than dying, they're being supported through life. And then there's a natural growth in the population just from the people that were already here, rather than just the immigrants. But I think saying it's an immigration problem is only a small part of it. I think it's the demographic blip of baby boomers aging.
Okay. So, you answered a couple questions. I'd like to thank you.
You're most welcome.
You informed me.
Thank you. Mr. Lilly will be correcting this,
Yes,
will you? Okay.
you will. Thank
Okay.
you.
Thank you very much.
Have a
Take
good
care.
rest of the day.
Bye-bye. He reviews it and then gives you a mark?
Yeah.
Okay. Don't forget your phone.
Yep.
That didn't take too long.
No. Took 6 minutes.
Oh, wow. Thanks.
Thank you.